No, it's actually 5:30. We've got a good chunk of people here, so I think probably we'll get started if you two are all set.
Yeah, sounds good.
Yeah.
Well, good evening, everyone. I'm Amy Hecklenberg. I'm an associate professor and the assistant dean for diversity and inclusion here in the University of Buffalo's School of Nursing. My pronouns are she and her. And I'm really excited to report that we have over 100 people registered for the event, including faculty, staff, students, and alumni. So welcome all of you. Thank you for coming. This event was spurred really by our heightened concerns last winter for the safety and well-being of the numerous Asian folks in our UB-Sun community, following the deaths of 8 women, most of whom were of Asian descent, in what we now know as the Atlanta spa shootings. And our concerns really were further solidified over time as horrifying acts of violence and discrimination targeting Asian Americans and Pacific Islanders became more visible and prevalent in our news feeds. And then with the emergence of the COVID-19 pandemic, anti-Asian sentiments became even more common occurrences in our healthcare settings, thereby adversely impacting Asian American and Pacific Islander nurses, including those who were perceived and are perceived to be AAPI. So as we sought ways to begin a school-wide conversation about this violence and promote a culture of civility, respect, and solidarity within our school, we stumbled across the work of our 2 awesome speakers tonight who we thought could help us begin that journey. Dr. Crystal Han and Dr. Angelina Pham are physicians who each have a history in our Western New York region. Some of you might have heard us talking about that. Dr. Han received her Doctor of Medicine at the UB Jacobs School of Medicine and Biomedical Sciences, and Dr. Pham received her BS in Biology from St. Bonaventure University before earning her Doctor of Medicine from George Washington University. And I'm going to let them say a little bit more about themselves in a minute, but I just want to go over a couple of housekeeping things before we get started. I wanted you to know, I think you probably noted that the event is being recorded and a link will be sent out to all registrants in the coming days or so, please remember to stay muted. I think all of you have got the Zoom down by now. Feel free, I posted in the chat, feel free to include an introduction in the chat if you're inclined, and maybe tell us a little bit about your specific motivation for attending this event tonight. And our speakers have reserved some time at the end for questions. So you can either type your question in the chat, or if you want to speak up, you can just raise your hand when we get to the Q&A, and I'll put a shout out to you and give you a moment to ask your question or make your comment. And if you want to anonymously, share a comment or a question, feel free to message me individually in the chat and I can share it and de-identify it. So without further ado, please everybody virtually join me in welcoming Dr. Han and Dr. Pham.
Thank you so much for that warm introduction. My name is Crystal Han. I am a second-year child and adolescent psychiatry fellow at the University of Maryland and Sheppard Pratt. I have specific interest in Asian American mental health, particularly in teens and young adults and the college student population, and as well as general cultural psychiatry. And I am also an APA SAMHSA Minority Fellow. And as part of that, Dr. Pham actually helps me run support/affinity groups for AAPI students in the Baltimore area. Thank you so much for having us here. I'll let Dr. Pham introduce herself.
Thank you, Dr. Han. Hi, everyone, and thank you again for being here today. My name is Dr. Angelina Pham, and I'm currently wrapping up my 4th and final year as a psychiatry resident at the University of Maryland. And then next year, I'll be doing a forensic psychiatry fellowship at Yale University. My interest particularly includes cultural psychiatry, minority mental health, as well as forensics, and particularly I'm interested in asylum and refugee mental health.
Great. Well, we can go ahead and get started. So our presentation today is titled Microaggressions and Racism Experienced by the AAPI Community. Some of our learning objectives include describing examples of microaggressions, reviewing the impact of microaggressions on mental and physical health, discussing the history of anti-Asian racism as it relates to microaggressions and beyond, and demonstrating ways to respond to microaggressions and harassment. Some background on the Asian American and Pacific Islander or AAPI community is really important to start us off. It's the fastest growing minority group in the United States. In fact, AAPI individuals under 17 years old will actually make up 7.7% of the total youth population by 2050. And a really important disclaimer when we talk about the AAPI community is that it is not a monolith. And Dr. Pham will reference this later, but Asia is actually the largest continent made of nearly 50 countries and languages. And so AAPI individuals stem from multiple different cultures, identities, familial factors. They have different degrees of acculturation and socioeconomic statuses. And so it's really important for that to keep in mind that while during this presentation, we might be making some generalized statements in terms of experiences AAPI individuals share, it's always important to come at each individual case with open-mindedness and respect for their unique experiences. So just for some review in terms of what is a microaggression when we talk about this term was actually coined originally by Harvard psychiatrist Charles Pierce in the 1970s. Our modern understanding of microaggressions is largely credited to psychiatrist Dr. Gerald Wing Su at Columbia University, and they're defined as everyday verbal or nonverbal slights or insults, whether or not they are intentional, which ultimately communicate negative messages and targets people based on their marginalized group membership. So that could be race, gender, sexual or gender identity, religion, class, or more. And while these examples may seem very innocuous and may not originally even be intended to be harmful, it contains hidden messages that you are a quote other. For example, in the example on the slide, some common experiences by AAPI individuals include being asked the question, where are you from? And when you respond, like something I would say would be like, I'm from Baltimore, there's a common follow-up question of, no, where are you really from? Or where are you originally from? Some other AAPI individuals have had experiences where people say, wow, your English is really good. And so this serves to kind of make you feel like you're not a true American, like you are an other or a perpetual foreigner in your own country and like you don't belong. And oftentimes the targets of microaggressions feel like they need to brush it off, or like we need to grow a thicker skin, or it's not a big deal, especially if it was intended to be friendly even. But the study suggests that these effects of the microaggressions, especially as it accumulates, it really does impact people's mental and physical health, even if that impact may be outside of our own awareness. Here are some examples of experiences by AAPI healthcare providers during the COVID-19 pandemic. So on this slide, this image is from a popular physician blog called Kevin MD, where multiple AAPI providers from all over the country joined together for this project, sending the message that is written out here. Dear patients, COVID-19 does not discriminate regardless of race, gender, background, orientation. We are here for you. And so the various news sources throughout the past couple of years in the pandemic detail specific AAPI experiences of racism during COVID-19. And here are some examples. For one example, in Seattle, a patient had requested a COVID test in the ED just because that person ate Chinese food earlier. Another instance, an AAPI individual was told right outside of the hospital they worked at, F you, go back to your country. In Boston, an anesthesia resident at MGH was followed from the hospital for a few blocks, being yelled at, why are you Chinese killing everyone? Multiple accounts in New York City had AAPI individuals being spat on near the hospital, being called racial slurs, being told explicitly, you people are not welcome. And there are unfortunately also many accounts of patients refusing care from AAPI providers all over the country. And so the impact of microaggressions and racism is very well documented in research that shows a very strong established relationship between racial discrimination and poor mental health symptoms. For example, in a study on 405 young adults of color, it was found that racial microaggressions predicted suicidal ideation that was mediated through depressive symptoms. And so some of the common adverse mental health symptoms resulting from racial microaggressions include depressive symptoms, which can include depressed mood, poor sleep and appetite, issues with concentration, and even suicidal thoughts. This can also include anxiety and fear, trauma symptoms, which can be like intrusive thoughts such as flashbacks or nightmares about the racist experiences you've had, hyperarousal and hypervigilance, which means feeling really on edge, like you can't really relax, you're always waiting for the other shoe to drop type of thing. Avoidance, finding yourself avoiding certain places or situations that reminds you of past racist experiences you've had, and generalized negative mood and cognition, where you find yourself feeling more negative and having more negative thoughts than before. There can even be somatic symptoms related to microaggressions and racism, including headaches, GI distress, such as nausea or constipation, and even medical sequelae, including heart disease and diabetes, mediated through an increase in your cortisol or like stress system, being overwhelmed by this kind of like constant anxiety and stress related to racism. And so while Trump and his administration's rhetoric around what they called the Chinese virus was very kind of a popular criticism and their use of the Kung flu and the Chinese virus to putting a target on the backs of the AAPI community, the reality is that anti-Asian racism has been quite historical and long-standing in this country. And it's just that in major crises, such as the COVID-19 pandemic, the racism that was kind of embedded in society rises to the surface and may become more acceptable for some people to express more directly what kind of was always there to some extent. And so xenophobia is the fear or hatred of what is perceived to be foreign, and it stems from the Greek terms xenos, meaning foreigner, and phobos, meaning fear of. And xenophobia has been a long-standing factor in America's treatment of AAPI communities. And so in this slide is a brief history of anti-Asian racism. Unfortunately, there are many more examples, but just as a recap, starting in the 1800s, in 1854, California Supreme Court case People versus Hall ruled that an Asian person cannot testify against a white person, which effectively rendered Asian communities unable to seek legal justice. In 1871, the Chinese massacre resulted in the mass lynching of 18 Chinese men, which is actually the largest mass lynching in US history. In 1882, the Chinese Exclusion Act was the first immigration law that excluded an entire ethnic group in the midst of the, quote, yellow peril rhetoric, which painted Asian people as an existential threat to white Americans and their stability, as depicted in this propaganda picture of Uncle Sam kicking out a Chinese person. A lot of people may be familiar with the incarceration of more than 120,000 Japanese Americans during World War II. And interestingly, the 1 year after that started, there was a repeal of the Chinese exclusion laws so that more Chinese people who gained citizenship can serve the US in World War II. In the 1960s, the model minority myth started to become perpetuated, which essentially positioned, quote, well-behaved, obedient, hardworking Asians in opposition to Black communities' rising social justice activism. And it also served to keep AAPI communities pigeonholed within certain stereotypes, such as politically silent, good at math, but quiet and not fit for leadership. However, very quickly, AAPI communities that are once seen as, quote, the model minority can quickly regress back to being seen as the yellow peril, which is evidenced by a similar increase in anti-Asian racism in 2003 during the SARS outbreak, as well as, of course, right now. So the reporting forum Stop AAPI Hate has now received more than 9,000 incidents of anti-Asian hate, both physical and verbal events since March of 2020. And of course, there's ongoing systemic racism against AAPI communities, which can look like lack of representation in the media, lack of representation in positions of leadership, lack of access to translation services within healthcare and other realms of society, and very importantly, the lack of data collection in multiple realms of society on individual Asian ethnicities and their unique struggles and experiences. The model minority myth is a little complicated and is worth some time breaking it down, as it's a really major factor in making invisible the struggles of AAPI communities until something overtly violent like the Atlanta shooting happens. So firstly, the model minority myth portrays the AAPI community as a monolithic and homogenous group, when in reality is comprised of, as I said, over 50 different languages and countries, each with their own complicated histories and cultures. And it paints all AAPI people as quiet, hardworking, academically and economically successful, and, quote, well-behaved. However, the wealth gap has actually grown the fastest and is the widest among Asians than any other ethnicity. So as such, the average poverty rate may be less than 5% for Japanese communities, but it's more than 15% for Hmong, Nepalese, and Burmese communities. The stereotype also erases and it makes invisible and delegitimizes AAPI struggles and individual differences, which makes people think that AAPI individuals are, quote, not a real minority and that they don't experience racism or hardship. And also, if an AAPI individual doesn't fit into this myth of being quiet and good at math, et cetera, it's hard for them to find a place of acceptance in both white and Asian society, because much of the model minority myth is internalized because it's presented as almost a good thing superficially, but its damage is actually very real but hidden. And lastly, the model minority myth is used as a wedge between Asians and making a flawed comparison between AAPI communities and other groups, particularly Black Americans. And it serves to argue that racism, including more than 2 centuries of Black enslavement, can just be overcome by working hard and having strong family values, and that ignores the powerful systemic ways that racism functions to maintain oppression. And so it falsely conflates anti-Asian racism with anti-Black racism. The reality is that all of these groups experience racism, but perhaps in different ways. And it ultimately distracts from communities of color to strive in solidarity towards equity for all. So as I mentioned, many AAPI and other people of color get the question of where are you from? No, where are you really from? And so this is an example of this perpetual foreigner stereotype that is essentially the propensity to ascribe the American identity to white European Americans and serves to other ethnic minorities. And it leads to microaggressions such as the example above, questioning someone's hometown, complimenting someone's English, which all serve to convey these messages of exclusion, whether or not it's intended. And in one study, awareness of the perpetual foreigner stereotype by people of color was actually a significant predictor of identity conflict and a lower sense of belonging to American culture. And above and beyond perceived discrimination, awareness of this perpetual foreigner stereotype significantly predicted lower hope and life satisfaction for Asian Americans. And so those results suggest that the perpetual foreigner stereotype may play a role in ethnic minority struggles with identity and adjustment. And as everyone may be aware, the past couple years during the pandemic, for many AAPI communities, it has gone beyond microaggressions to racist acts of violence all over the country. It was unfortunately very easy to collect some of these headlines. An AAPI father and his 2-year-old and 6-year-old children were all stabbed at a Sam's Club in Midland, Texas. There's been multiple attacks on AAPI community members reported in Oakland and San Francisco, California, as well as Midtown Manhattan and other parts of New York City. And broadly publicized was the anti-Asian shootings in Atlanta, killing 6 Asian women. And there's been ongoing reports, even recently, of other incidents, similar, both verbal and physical attacks. So now I'm going to pass it along to Dr. Pham.
Thanks, Dr. Han, for the first half of the talk. So for the second half of the talk, I'll be focusing on how to handle microaggressions, as well as kind of talk about the unique struggles with microaggressions in nursing. So first off, what can you do if you experience or witness a microaggression? If you ever find yourself in such a situation where you experience or witness a microaggression, it's important to first evaluate if you should even respond to it. Things to consider would be to think about whether or not you feel physically your safety might be in danger if you do respond. Like, for example, thinking through, like, could the person become defensive, thereby leading to an argument? Also thinking about what it would be like if a person were to get hostile or defensive, what would you do in that situation? I want to also take a moment to emphasize that there's no obligation on the victim's part to respond, and that in incidences of racism, your sense of safety and the energy you have at the time is your prerogative, and there's no right or wrong way to respond. It might be helpful to also consider, though, if you do not respond, will you regret not saying anything, or would you feel like it would convey a message of acceptance of the behavior? So Dr. Diane Goodman is a diversity consultant, and she came out with a really helpful article with various templates on how to respond. And some of the examples we've listed here includes like asking for clarification to bring attention to the inappropriateness of a microaggression, but doing so in a non-aggressive way. So, for example, if a patient states that they want a different non-Asian provider because they don't want to get COVID, you can say something along the lines of, could you say more about what you mean? Or how did you come to think of that? That helps separate intent, and separating intent from impact might look something along the lines of saying, I know you didn't realize this when you assume an Asian provider will give you COVID, but it's hurtful because it implies Asian people are at higher risk of having and transmitting the virus, which is untrue. Instead, you could express your concern in contracting the virus and your anxiety about your health, which we can talk about. Lastly, you can also try sharing your own journey and how you have had a certain preconceived thought, but you are able to change those thoughts and assumptions based on what you've learned along the way, so as to not make the person feel like you're shaming them. The main principle underlying these techniques and statements is to help the aggressor understand that they're not being attacked for their comment, but rather it serves as an opportunity for people to hear things from our perspective and potentially change how they act or think about things. And our goal is not for this to cause them to become defensive or for this to blow up into a heated exchange. Next slide. So Georgetown University School of Medicine came up with a template of what to do with inappropriate behavior in an academic medical setting. And they coined this technique the stop, talk, enroll. However, this technique can also be applied in other situations, such as in the workplace or at school, where there might be some sort of like power dynamic structure at play. So stopping the conversation may look like saying, I hear your concerns and I'd like to consult with another team member and get back to you, versus with direct harassment, that's not appropriate language and we'll return when we're all ready to use respectful language. Talk means discussing and processing it with a supervisor or colleague, maybe saying like, hey, I'm feeling XYZ about this and I'm not sure the best way to respond. It would be helpful to talk it through with you. Roll is the last step with rolling on to support. Some places consider seeking support, where you could consider seeking support includes like the Office of Diversity and Inclusion, as well as talking to an ombudsman person, or also reporting the incident through like institutional channels. Next slide. Lastly, the Holla Back movement to end is like this movement that was started to end harassment, and it offers resources and trainings on things like bystander intervention, mainly in incidences of harassment in public. And so they have this technique called the 5Ds, which are the different ways that one can respond. Distracting looks like engaging with the victim to interrupt the harassment, such as by asking the victim for the time or for directions to help de-escalate the situation. Delegate is asking for help from others around. Delaying looks like checking in with the target after the incident is over and asking how you can help. And then direct intervention is speaking out directly, calling out the harassment, or actively asking how you can help at the time. And then documenting may be in the form of videos or filming the incident, making sure you also maintain a safe distance and try also to like film landmarks or streets, but always make sure that you ask the target's permission before doing anything with the footage. Next slide. So nurses are in a very unique position because they spend a lot of time interacting with patients, their family, or their caregivers. And this can help establish a great sense of rapport, trust between the patient and the nurse. And it's very much essential in patient care, but it can also create situations where the patient and or their families may feel more comfortable asking personal questions that could include microaggressions. These microaggressions can catch the nurse off guard, and they might end up asking themselves like, wow, did this really happen? Oftentimes, they might even gaslight themselves and invalidate their experience by thinking things like, oh, maybe I'm being overly sensitive, or maybe I'm misunderstanding the patient, like maybe I need to grow thicker skin and just not worry about it and try to brush it off. And for nurses, it can feel quite burdensome to have to create the mental space to think about this, thinking about whether or not to respond or to address the microaggression when they already have, a pretty busy schedule, like taking care of patients and making sure that they're doing the best for their patients. Figuring out whether or not to respond is just the beginning, and there are other factors to consider as well, such as evaluating the risk of responding, determining where or who to turn to for support, and also determining how to respond. Additionally, nurses may feel conflicted morally or ethically when placed in a scenario where they must determine whether or not to respond, as they try to find a balance between the desire to be patient-centered versus the desire to also protect their own sense of integrity and right to be treated with respect. And as we dive into this a little further, we recognize also that nursing students and new nurses may feel that there's some sort of power differential or dynamic in the workplace, making them feel really insecure or disempowered to confront microaggressions by other staff members, such as charge nurses or supervisors. And in that they feel invisible and they feel voiceless, unsupported, or they worry about the negative repercussions if they were to confront the issue. So what ends up happening is the nurse feels isolated and they feel it's their problem to solve on their own, but then they don't feel like there's a safe place to really process or discuss the incident. Additionally, there may even be like individual and professional impacts on the individual or nurse that's facing the microaggression. For example, if a person or patient requests a different nurse solely based on race, this request might be perceived by supervisors as incompetence on the part of the nurse rather than a microaggression. And this could perpetuate a cycle of doubt in the nurse in future incidences where they may feel inadequate or incompetent, not realizing that it had nothing to actually do with the nurse's skills, but it was actually a microaggression. If this situation were to come up, it would be important to understand why the patient is requesting a different nurse. And one could ask the patient, like, hey, I'm curious why you would like a different nurse, or asking something along the lines of, I'm wondering what I did that has made you feel unhappy with my care. Lastly, dealing with microaggressions can be very emotionally taxing. It's important to seek help if you face a difficult experience with microaggressions, talking to friends, someone you trust, trying to seek help through the hospital's like employee assistance program, or through the Office of Diversity and Inclusion. The burden should not solely be on your shoulders. At an organizational level, there also needs to be changes that gives nurses the support and resources to effectively address and process these situations, and also know where to go in these situations. So these are just a few issues and techniques to get you started with handling microaggressions. To recap, if you face a microaggression, first and foremost, you should assess whether or not you feel safe, or if you have the time and energy to address it. And then also weigh the whether or not you would be okay with walking away with it versus like if you think it's appropriate to address in that situation. And again, I want to emphasize that you're not obligated to always respond to every microaggression that comes up. And if you do end up choosing to address the microaggression, then just remember that the goal is not to instigate an altercation, but rather to use it as an experience or a way to educate others and help them understand your perspective. So thank you for taking the time to listen to our talk today. These are our emails and contact information if you would like to reach out or have any other questions after the talk. And then I think the next slide is just some of our references as well.
And I'd love it if we could stimulate some conversation now. Comments, questions? I don't know if anyone has any of their own experiences or observations to share. Perhaps you've seen some particularly effective ways that others in healthcare settings have managed to respond to microaggressions when they've experienced them. If you want to put them in the chat or just raise your hand, I'll try to skim through and see if I can see anybody's hands. There are 92 of us here. I know someone has a question or a thought. Sarah was kind enough to share some of her own experiences moving to Northwest Virginia. I don't know if you want to say something about that, Sarah. I don't want to put you on the spot, but she did provide some comments in the boxes. Thank you for that, Sarah. And do you want to add anything, or are you good?
Yeah, so basically I moved to Northwest Georgia last year, and since being there, I have seen and heard a lot of microaggressions. I actually live only like 45 minutes out of Atlanta, and so when the the Atlanta shootings happened, I was really struck. But unfortunately, a lot of the microaggressions you spoke about today, or like some people not thinking it's a really big deal, that happens on a day-to-day basis in especially southern United States. Just because I was born in in New York, many people have discriminated against me. So it's really sad when I see microaggression, especially in different communities. And like, I always try to make sure that I'm inclusive of everybody's like race, religion, sex, and so on and so forth. And it's more common than you would think, you know. So that I was just saying my experience, and yeah, it's just really sad because it's like many people, they don't like expect it to be there, but or like even in bigger cities, but then like it does happen, and when it does happen, you need to speak up.
Thank you, Sarah. We have a couple questions that are sort of interrelated. One of our faculty asks, how would you suggest addressing student-to-student microaggressions? And someone else asked about being an ally and knowing when to respond and how to respond and when it's appropriate.
Yeah. Well, Sarah, first of all, thank you so much for sharing about your experience and the things that you've noticed. I really appreciate you bringing that to our attention, that, you know, this is really true, that is ubiquitous, even in places that you think should be a big metropolitan with a diverse population. And so it speaks to how common it is and how much we appreciate all of you being here to start this conversation and thinking about it, because I really think that's the most important and first step. In terms of student microaggressions, well, I think in all instances, it's a very case-by-case basis. I think that it depends on like the context. Like if this is something that happens in like a patient's room, it may not be necessarily appropriate, you know, to like address right then and there. If it is alternatively in like a classroom didactic setting, maybe it is more appropriate to kind of like address and explore. I think that it's just really important to consider the victim or target of the microaggressions safety, because there is risk sometimes to this. Like Dr. Pham was saying, there are times where you can instigate or escalate something in a certain situation by calling it out, and that, you know, calling it out should not be the end all be all of interventions. And so I'd say that for the example of like the student one, if it were me with students in like a classroom setting and I felt like it was posited at the beginning that this is a safe space where we're here to learn and we are here to really be supportive of each other's learning and respect each other, that might be a place where I just kind of do some of the things Dr. Pham mentioned of like exploring where that microaggression came from. Like, you know, what went through your mind when you said that? You know, where did that come from? What kind of experiences or like facts that you feel like you've come across that made you say that in a way that isn't shaming and would cause it to shut down, but rather to have it be an opportunity for growth and learning. I don't know if Dr. Pham, maybe you have more thoughts on this.
Yeah, I wanted to emphasize again that it definitely depends on like the situation and the environment at the time. Sometimes if it's like happening like when you're in a patient room or something, that could be something that you could address later on. And also I would make sure to check in with the victim in that situation to see how they felt and see if they were comfortable about you bringing that to the aggressor's attention as well. And just using that as an opportunity to really strike a conversation, because sometimes the aggressor might not have even realized that it was a microaggression in what they said. So that's why kind of getting a sense of where they were coming from or how they came to express that is very important too.
Thank you for those thoughts. Yeah, it reminded me that we've had some conversations about the importance of including something about inclusivity and civility in our syllabi, and trying to find that balance where, you know, our syllabus is becoming like 20 pages long. and the importance of, if we're going to have it in there, don't assume that anybody's reading it. Spend a few minutes in the beginning of class to set that tone and develop a culture of expectation about that. And so that's something you could return to. Like, remember, we had this conversation at the beginning of the semester, and we've established, a culture here, and we need to explore some of the things that are, that are going on currently in the classroom. And so I think it is a good idea to establish that foundation. Let's see, I had a question sent to me. It's a little bit similar to some of the things you were suggesting during the talk, but again, returning to sort of a patient nurse situation, particularly perhaps with older patients, or perhaps those who are suffering from some illness where they're not perhaps, able to make kind of logical decisions. How should a nurse really approach those kinds of situations?
Yeah, if a patient is there and they're medically sick and they might be like altered or delirious or something, and they're making these microaggressions, it could be because in that moment they're not in the sound mind state. I think in that situation, it'd be better just kind of keep it simple and just address and just say, hey, that's not appropriate to say that, would be best, because they're just not in the right state of mind to even process anything further beyond that.
And I will add that I think that a lot of people think of, my interventions to address microaggressions as like, how do we handle it directly with the aggressor in the moment? But I think that managing microaggressions and the impact of microaggressions, there's like all sorts of things you can do that is indirect. Like I think that there are some studies relating to burnout specifically, that having process groups and having explicit support of being able to share these experiences with a community outside of the event of stressful or traumatic situations is really, really helpful and useful in preventing kind of like adverse mental health sequelae after it. So if it is the situation with certain patients, either medically or psychiatrically, it's really hard to see the utility in confronting it right then and there. I think that's important to be said, that support, not suffering alone and in silence, and not operating in a silo, really seeking help to, build community and share and process with other people who have either gone through the same things or maybe not, just people who care about you, can be equally, if not more helpful than, figuring out what to do in the moment.
That's a fantastic point and so critical. And, also you raised the point of going to your nurse supervisor. Some people might miss these things happening in a patient interaction, and calling their attention to it makes them more sensitive to it, and they can be more proactive and more responsive and more supportive about it in the moment, and also, in future interactions with patients. Someone asked, are there things that one can do to proactively prevent microaggressions from even taking place? Okay.
I think that just like on a societal level, like bringing a lot of awareness, holding these, talks and hosting these things and having spaces to have these conversations so that we can, talk about microaggressions and inform others of what it is about and educating others about it. Because, prior to about 2 years ago, I don't think even I knew what a microaggression was. So I think that education and spreading the word is very important. Having safe spaces for people to, talk about these things as well is also really important. Dr. Han, I don't know if you have any other ideas.
It kind of brings to my mind kind of discussions I have with teams in our clinic on like inclusivity and just really different ways to send really obvious messages that this is a place where all are welcome. And we are, we have that in mind. Like, for example, certain flyers, we have advertising groups and stuff, having those be in like different languages, or like hotlines that we have, having that on the walls being in different languages sends a message of like, this is a place where we value people who are different and who, you know, may have different backgrounds and experiences, and that sets a tone. I'm in child psychiatry, like the books that I have in my office, I've tried to make it with like books and like dolls of different colors. And I also happen to teach a cultural psychiatry intro lecture to medical students, where I have a disclaimer slide that says things like, you know, talking about culture and race can bring up a lot of different feelings, and that's okay. You might find yourself feeling guilty or defensive or, you know, upset, and that's okay. You know, try on these ideas for size. And when you speak about things, you know, speak your story, speak for yourself. And what's the slide say? It says like, acknowledge the intent and acknowledge the impact of what you say. Sometimes microaggressions, most times actually, I think microaggressions are not intended to be harmful. That's because microaggressions come from implicit and unconscious biases that we have from like moving through our lives in white society. And that's to be expected, and that's okay. But acknowledging the impact of what you say is really important. And that's what can be hard, because when you don't mean to be harmful and people are coming at you saying like what you said was like, you know, messed up or hurtful, you know, it's okay to say, I did not intend that. I recognize the impact that it was harmful, and it's valuable for growth. So I feel like the best thing we can do to proactively prevent it is kind of just like facilitate a culture of being able to think about these things without being defensive, promote introspection and reflection, because I think it starts with each one of us. I have biases, like, you know, none of us are free from this, but just promoting a facility and a workspace that, yeah, that supports this kind of like culture and thinking, even with all of like the painfulness and like messy feelings that it comes with.
Thank you so much for that. I think you've hit the nail on the head. And I think, and I hope that having more and more of these conversations will make us all more aware and more able to recognize, you know, we aren't all perfect, but when we make a mistake, learn from it, apologize if you can. If you can't, learn from it and try to avoid doing it in the future. We had a comment sent to me, which is not really a question, but Dr. Han's slide on anti-Asian racism in the US over the last 100 years was eye-opening to me. These are situations that we really aren't taught when we're growing up, and how, you know, microaggressions are very long-standing in the US. I think that we need to be reminded of these events to help combat microaggressions. So yeah, I think it's really important the way that, and useful the way that you tied it to history. This just didn't happen, you know, in a vacuum. This has been happening for a very long time. Someone else said, I think in the workplace, I think it's important for everyone to be aware of their unconscious biases and acknowledge and manage that. Some workplaces develop a training program for their employees to understand how cultural differences can impact how people work, which is, you know, fantastic. The problem is unconscious biases we're not always aware of. So we have to be very introspective and constantly be questioning our own intentions. Someone else added, thank you for speaking up about microaggressions. As someone who has been asked questions such as, where are you from? And are you Chinese? And people making faces at me. I'm glad that this problem is being addressed. As an Asian person, I'm very quiet and I don't speak up much. And I know many people who experience the same thing as me. I brush these comments and try to grow a thick skin. And sometimes I don't even think it happened to me and just ignore it. We don't get much representation and are always labeled as quiet, but these problems need to be addressed. Thank you for taking the initiative and spreading the awareness. Thank you for that.
Yeah, I really appreciate you sharing that. And you're not alone by a long shot. So thank you.
And I think you've mentioned this, the insidiousness of microaggressions is that, it's gaslighting, right? Is that the right term? Because people, begin to question, did I hear that right? Am I making too much of that? And then they question themselves when it happened. You are experiencing that. It's not something that's all in your head. Other questions, comments? I'm looking to see if we have any raised hands. I like to let silence settle in a little bit and see if we have any other thoughts that come to mind. I don't want to torture everyone, but well, it looks like we're perhaps coming to an end.
Hi, Amy. I have a quick question, if I may ask. Hi, thank you so much for the presentation. I think I want to circle back to that question about what can our non-Asian counterparts, colleagues, supervisor can do to support us when microaggression or actual aggression that occur. I have a sense that it means a lot. If we're going to try to deconstruct the systemic racism that is currently exists today, we really need to corral those people who are in power to change things, whether within the healthcare system, as physicians, as a professor like yourselves, what specific things they can do to help. And I think unconscious bias is a good place to start. For example, the definition of beauty, is it blonde hair, blue eyes all the time? We don't have to look far. We can look at Disney World, Disney, characters, for example. So I just want to kind of ask you for elaboration on that. Thank you.
I think that's a great question. And I think the question of what can non-Asian counterparts or people empowered do about both AAPI, advocacy and just racism and systemic racism in general is a very complicated question. I think that interventions and there's room for improvement in almost every facet of medicine. Like, for example, I do a lot of work and I'm interested in teaching. I think that the really obvious stuff is kind of like integrating this more into the curriculum. I can speak mostly to psychiatry, of course, but I think it's really important to have different case examples from AAPI kind of like communities and AAPI specific challenges in our cases in terms of psychopathology, our diagnostic biases within psychiatry, and thus treatment biases in the curriculum, learning about cultural psychiatry, which includes different communities' expressions of illness and distress that may be different from westernized common, distress, and having that be modeled in medical practice, seeing your supervisors and attendings in psychiatry model that actively every day, talking about it in clinical work, not just in the classroom, as well as, for example, in applying the cultural formulation interview to every patient you see and coming at it in like a culturally sensitive way, outside of just AAPI issues like LGBTQ issues, kind of like really encapsulating that mentality when you work with patients all over. And, in other realms of like research, really advocating for the research patient samples to be diverse and representative of the generalized population, really making sure that there is equal access to research studies and like trials for every community, positions of leadership, of course, in every facet. If someone isn't represented at the table, maybe this is worth questioning: who is missing, why are they missing, What are we missing because their voice is missing? And that can be at every level. And I think that in personal and workplace situations, it does start with kind of you introspecting for yourself, like, what are some things that I really haven't been taught, growing up about these biases, and what does that mean about my interactions with either friends or like colleagues or other people in the workplace or otherwise, and being aware, because there is such thing as a minority tax, as they say, or putting the burden of educating others on those people themselves in these marginalized groups, when there are a lot of resources out there that are, open to everyone to kind of put in the work, as they say, to like educate yourself on some of these experiences and issues that maybe your AAPI peers are kind of too exhausted maybe to bring up themselves. So those are some things that come to my mind. Dr. Pham, I don't know if you had things to add to that.
Crystal, your answer was fantastic, and you really hit the nail on the head with that. Yeah, I think that representation is big. And I also think that introspection is really, really important, no matter at what position you are, and always just reflecting on like how you can improve and being receptive to, fear, like comments. If someone brings up like, hey, maybe like I felt a certain way about what you said there, just being humble and open-minded is really important as well.
Meg, Dr. Dorsbacher, I don't know, you posted something about you'd love to learn more about the ways to respond to microaggressions, those 5 Ds, how else those can be used by allies. I don't know if you want to say anything more about that. I don't know if the two of you have anything else to add.
That wasn't a very articulate question. I apologize. It's that time of the day, but yeah, I really think for those of us in the non-minority population, I'm almost afraid to admit, that we need to learn how to be better allies. And this is a great step, but it's not the only thing. And if any of you have an opportunity or are willing to share, I'd love to hear if you have any stories about times when you were on the wrong end of a microaggression and maybe someone was an active bystander and did intervene, and how that went for you and how that made you feel. Or if, theoretically, if that happened, what would you hope to see?
Yeah, thank you for that. The times when I have been like the victim of a microaggression, I think they were in instances where it was more isolated and there wasn't really anyone around. Sadly, in most of those situations, I ended up choosing to walk away because I felt like my safety was more important and I didn't feel safe confronting it in that moment, especially when there weren't any bystanders around. But if there were bystanders around, I think we would appreciate, just someone being like, hey, that's not right, like, and calling it out, I think would be helpful. Or if someone notices it seems like it's escalating, to kind of distract that individual so that we can kind of get away safely and just feel like we're not going through it alone by ourselves, I think so. Even if it's just like after the fact, checking in, being like, hey, I saw what just happened and that wasn't right. Like, are you okay? I think would carry a lot of weight for someone like me in that situation.
Thank you. That's really helpful.
Yeah, the 5D specifically pertain to kind of bystander intervention, kind of like in the community. I did post the Hollaback organization link that is the author of the 5Ds. I think that in general, for those who are in a more dominant group or a position of power, I agree with Dr. Pham that it is really powerful and validating to have that person stand up for you if they are able to recognize what's going on and comfortable with doing so. I remember that as an intern, I was in the psychiatric emergency room, and we had a really, honestly, it was a personality disordered patient who comes in often to kind of like demand food more or less, and then doesn't want psychiatric care. And it's a very tragic case, actually. But he was very racist. And at one point, when I was not accepting some of his demands, he had called me a CHINK N-word, which was something that I didn't even know was an insult, but he had called it to me, and I was with my senior, who was a white female. And, you know, especially as an intern, and I'm sure like student nurses can attest to this feeling as well, like you just really don't, like, you want to be helpful to the patient, you want to like maintain that like relationship, you want to be professional. I didn't say anything, but my senior really jumped in and said, you know, that is really inappropriate language. We are not going to stand for it, and we're going to leave now until you're able to use more respectful language. And she like, you know, left and told me to follow her. And so that was a really powerful moment, because for me, if she didn't do that, I probably would have taken it as a message of like, this is something that I should just accept, and this is part of my job description, and I'm not allowed to, you know, stand up for myself, essentially. But she showed me and, you know, kind of did it for me, and did not put the burden on me either, which was really helpful. And so I think that's an example where if something like that happens and you feel like you're willing and able to be that person, I think it would make a big difference.
Thank you so much for sharing those experiences. I think it's important often to have like specific examples. They really give depth to, you know, the larger conversation we're having. And I'm being cognizant of the time. It is 6:30. I want to thank both of you for so much for coming. There have been tons of comments in the chat, thanking everyone. It's been really enlightening. I think it's important to remember this is just the beginning of a conversation, and it's a fantastic way to start and a fantastic foundation. But I think you're right. Like, we all have to take the initiative to, you know, move forward and learn on our own and have a voice and be good allies and all that. So you've given us some really great tools. So thank you very much. Thank you for everybody for coming. I also wanted to extend thanks to our JEDI ad hoc committee members who, you know, came together during the summer to put this all together. And I just want to put a shout out to them: Jennifer Schreier, Amy Lyons, Molly Oldenburg, Daryl Samayaji, Patty Nisbet, Ping Kang, Tanya von Bisger, I always say your name wrong, I'm sorry, Jennifer Livingston, and Elizabeth Wynn. So thank you all. This wouldn't have happened without you. And as noted earlier, I'm going to send out a link to the recording of the event in the next day or so. And also, I just wanted to put in a little shameless plug that if you are so inclined to and able to provide any financial support to our JEDI fund that helps support you know, various initiatives we have across our school, please check that out on our JEDI website. And I posted the website earlier in the chat so everyone can take a look at all the fantastic things we're doing. But thank you so much to both of you. And I hope when you come to Buffalo, perhaps you should check in with me if you have time, and we could get together. It'd be fantastic.
Thank you so much for having us.
Thank you again.
Thanks everyone for coming. Have a good night.
Thank you.